Hello, my name is Natalie. I'm going to be your student nurse today.
Okay.
Are you in any pain?
No.
Okay. Can I see your wristband?
Yes.
Can you tell me your name and date of birth?
Harmony McCarter, 10/03/2002.
Thank you. Today I'm going to be performing a neuro exam on you where I test your reflexes. I look at your vision, I look at your hearing. Is that okay with you?
Mm-hmm.
Okay. Have you had any concussions?
No.
Okay. General cues: patient is conversational, looks or stated age, dressed appropriately for the occasion, good hygiene, pleasant to be around. Okay. Can you tell me where you are right now?
College of Nursing.
And can you tell me what day of the week it is?
Thursday.
Okay, perfect. Patient is oriented and her level of consciousness would be a 15 on the GSW scale, Glasgow Coma scale. I'm now going to have you get up and I'm going to assess your gait. So if you could walk to this table for me. Okay, and you can turn around and walk back. Okay, thank you. Patient's gait is stable, stride is balanced, posture is straight, and arms swing opposite one another. Okay, I'm now going to test your cerebellar function, which is your balance. So if you can go ahead and walk heel to toe for me to the table. Okay, thank you. And then you can go back to your spot. You don't have to, okay, if you want to.
Okay, yeah.
Okay, and then if you can go ahead and stand on one foot for me and bend down to the floor. Thank you. And then you can do it with the other leg. Thank you. Okay, that was the shallow knee bend. So patient passed the shallow knee bend and the heel to toe test, so her cerebellar function is intact. Okay, you can go ahead and sit back down now for me. I'm now going to test your deep tendon reflexes. I'll start with your patellar. So, if you could scoot back a little bit for me. Thanks. Okay.
Is that good?
Yeah. This isn't gonna work.
Yeah, it is.
Do I do it with this?
No, do it like this.
Oh, okay. Okay.
Like swing it.
Okay. I just don't want to hurt you. It's like,
No, you're good.
okay, I'll just say that.
Yeah. No, I actually didn't.
Okay. Patient's patella reflex was a 1 bilaterally. I'm now going to test your plantar reflex. Could you take off your shoes and socks for me? Thanks. Okay, and I'll use this. Okay. Oh, can you go ahead and actually sit back and I'll break this up for you.
Yeah.
Is that comfortable?
Yeah.
Okay. Okay. Patient had no response bilaterally to the plantar reflex. You can go ahead and sit up. And then I'm now going to test patient's sensory function to sharpen dull stimuli. So this is what the sharp is going to feel like. Hold on, let me get the lead out. Okay. This is what the sharp is going to feel like.
Okay.
And this is what dull is going to feel like.
Okay.
Okay, you can go ahead and close your eyes. Okay. And just tell me if it's sharp or dull.
Sharp.
Yep.
Dull.
Yep.
Dull. Dull. Sharp. 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 It's really stopping you. Sharp.
Okay. Patient's upper extremities or patient's sensory to sharpen dull stimuli on the upper extremities is intact. And I'll do your legs.
Sharp. Dull. Dull. Dull.
Okay.
Dull. Dull. Sharp. Sharp.
Okay. Patient's sensory to sharpen dull stimuli on the lower extremities is intact. I am now going to start with the cranial nerve. So have you had any change in smell?
No.
Okay, patient's cranial nerve 1, the olfactory cranial nerve is intact because their smell has not changed. I would now test her visual acuity with a Snellen chart by having her close one of her eyes and standing 20 feet away and reading to the lowest line she possibly can, and then doing that with the other eye as well, and then opening both of her eyes and doing that. while wearing contacts and glasses, and her expected results should be 20/20 If it's 20 or 30 or higher, she should be referred to an ophthalmologist. I would also then perform the near vision test, where she reads 14 inches away from her 14-inch font, and if she moved the paper, then her vision or her second cranial nerve would not be intact. Okay, moving on to cranial nerves 3, 4, and 6. I'm going to be performing the 6 cardinal position test on you.
Okay.
So just follow the tip of this pen light with your eyes. Okay. Patient's eyes did not waver during the 6 cardinal position test. I'm now going to be looking at the size of your pupils. Okay. Okay. Pupils are 3 millimeters, are round, and are equal. I'm now going to be flashing this light twice in each eye. Just look behind me. Okay. Okay. Patient's eyes constricted to direct and consensual light. I'm now going to be having you follow pen light with your eyes. Okay. Patient's eyes during the accommodation test constricted and converged. So patient's cranial nerves 3, 4, and 6 are all intact because her eyes did not waver during the 6 cardinal position test, and her pupils were a size 3 millimeters width and showed perla. Okay, I'm now going to be moving on to cranial nerve 5, the trigeminal nerve. So I'm going to touch a couple spots on your face, and you can just close your eyes and tell me. This is what it's going to feel like, by the way. And you can just tell me when you feel it.
Okay.
Okay, close your eyes.
Now.
Okay, you can open your eyes. And now if you can just clench your, patient's sensory feeling was intact. Okay, I'm now going to have you clench your jaw. Okay, patient's temporal and masseter muscle was strong and symmetric, so cranial nerve 5 is intact. I'm now going to be moving on to cranial nerve 7, the facial nerve. So if you could smile for me, and if you could frown, if you could puff your cheeks, okay, if you could lift your eyebrows, and then if you can close your eyes. Okay, perfect. Cranial nerve 7 is intact because she was able to perform each of the 7 facial movements. Now I'm going to be testing cranial nerve 8, the acoustic cranial nerve. So if you can turn that way, and if you can close one of your ears, and if you could just repeat back the whispered word I say to you.
Christmas.
Okay. Springtime. Okay. Oh wait. Could you actually cover the other ear?
Yeah. Halloween.
Okay. Cranial nerve, you can turn back this way. Cranial nerve 8 was intact because she was able to complete the whisper test without me having to raise my voice or repeat a word. Okay, cranial nerve 9 and 10 I will now be performing. So if you can just open your mouth and stick out your tongue and say, ah. Okay. Cranial nerve 9 and 10 are intact because her uvula rose midline with phonation, and her soft palate did as well, and her tonsillar pillars went medial with phonation. Okay. Cranial nerve 11. I'm going to test your muscle strength to your sternum, to your trapezius. So if you can shrug your shoulders. Thank you. Okay. Trapezius was symmetrical and strong. I'm now going to be testing your sternomascoid. So if you could, I'm going to put my hand here, and if you can turn to face that wall. Okay, and then vice versa. Okay. Sternomascoid was strong and symmetric. I think that's right. So cranial nerve 11 was intact. Moving on to the last cranial nerve 12. I am going to have you stick out your tongue and move it side to side. Okay, can you repeat these words? Light, tight, dynamite.
Light, tight, dynamite.
Okay, cranial nerve 12 was intact because she was clear and distinct with her light, tight, and dynamite, and her tongue was midline. Okay, do you have any other questions for me?
No.
Okay.